بسم الله الرحمن الرحيم. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي رب زدني علما. I'm Dr. Qasim. I'm a senior manager, new products. Today I will discuss the Ceclor Pocket Info. Ceclor contains Cefaclor and is available in suspension and capsule and in drops forms. Suspension is 125 mg and 187 mg and 250 mg per 5 ml, and the drops is available in 50 mg per 5 ml. The therapeutic classes belong to second generation cephalosporin. Its mode of action: Ceclor acts by acting on specific penicillin binding proteins, which are mostly transpeptidases that serve as drug receptor on bacteria. Inhibition of cell wall synthesis by blocking transpeptidation of peptidoglycan. Activation of autolytic enzyme in the cell wall, which result in the lesion that cause bacterial cell death. Indications: upper respiratory tract infection, sinusitis, sinusitis is infection of sinus, pharyngitis, it's an infection of pharynx, and tonsillitis, it's an infection of tonsils, and otitis media, it's an infection of middle ear. Lower respiratory tract acute bronchitis, that is inflammation of bronchi, pneumonia, that is inflammation of lung, particularly the alveoli, acute exacerbation of chronic bronchitis. Urinary tract infection, lower urinary tract infection, cystitis, inflammation of urinary bladder, bacteriuria, that is presence of bacteria in the urine, and gonococcal urethritis. Skin and skin structure infection. Dosage: children 20 mg per kg per day every 8 hours. In more severe infections, otitis media and infection caused by less susceptible organism, 40 mg per kg per day in divided doses with a maximum dose of 1 gram per day. Ceclor 187 mg per 5 ml is indicated in pharyngitis, 20 mg per kg per day in divided doses every 12 hours, and otitis media 40 mg per kg per day in divided doses every 12 hours. For adult, capsule 250 mg and 500 mg every 8 hours. Bioavailability. Bioavailability is the fraction of a dose of a drug that is absorbed from its site of administration and reaches in an unchanged form the systemic circulation. It's well absorbed and independent of food intake. Metabolism is 15 to 40%. Half-life is 0.6 to 0.9 hours, that is 36 to 54 minutes. Half-life is the amount of time required for quantity to fall to half its value as measured at the beginning of the time period. Unique selling points: Ceclor is stable against beta-lactamase. Ceclor has high tissue concentration. Ceclor has better absorption and GI tolerability. Absorption rate is Ceclor is 90 to 95% as compared to amoxicillin, that is 50 to 70%, and clavulanic acid 25 to 40%, and clarithromycin, that is 50%. Ceclor has high clinical success rate in upper respiratory tract infection. That is 99% pharyngitis and tonsillitis, 98% acute otitis media, 93% acute sinusitis. Relapse of pharyngotonsillitis patients treated with amoxiclav is 2.6% higher than the Ceclor. In pharyngitis and tonsillitis, Ceclor has 97% bacteriological cure rate. Ceclor has high clinical success rate in lower respiratory tract infection, that is 95% pneumonia, 94% bronchitis, and 94% acute exacerbation of chronic bronchitis. High clinical success rate in acute lower tract respiratory tract infection of Cefaclor is 97% as compared to Cefaxime, that is 94%, and amoxicillin clavulanate 79%. Ceclor has high clinical success rate in 97% in UTI, urinary tract infection. Efficacy in children in acute otitis media, Ceclor has 98% clinical cure rate as compared to amoxicillin and clavulanate is 85% and 95% bacteriological cure rate as compared to amoxiclav is 78%. Ceclor has lower GI side effects, that is diarrhea 1.4% as compared to Cefaclor that has 16% and clarithromycin is 15% and amoxicillin is 8.8%. Ceclor has less incidence of treatment failure as compared to Cefaclor 20% and clarithromycin 21% and amoxicillin clavulanate that is 8%. Pregnancy, it belongs to pregnancy category B. Thank you.